Be good for tracking, for tracing, for infection control, just to be available, to provide healthcare for students who needed it. The bill died again due to funding. It's just not a priority of the administration right now to have a school nurse in each school. We turned the bill, though, into a work group. So we are going to take many stakeholders, so a lot of the school nurses associations, educators, parent-teacher union things, and have everybody come together and answer some unanswered questions. Which localities will this affect, that they will have to hire more school nurses? What's the best school nurse to hire? Should it be an RN? Should it be an LPN? How are we going to implement this? So by the end of the year, we should have some answers to those questions, and the legislation will be back. I still think it's a good idea. I'd like to see that venue of having a school nurse in each school be a way that we provide some additional healthcare for children, low-income children, children that don't normally have that benefit of being able to see a doctor, routinely seeing a healthcare provider. I think we can use, every kid has to go to school in some way, shape, or form. So if we can have a healthcare provider on site to provide some of the routine preventative services that are so important to starting out with good health, because we can start there. Hopefully we can instill some good habits. We can continue, that, because that saves healthcare costs down the road. If you can start that education earlier, emphasize, good nutrition, exercise, weight loss, all these wonderful things that I think we overlook sometimes that are really important components. My job, I've seen so much lately, people gaining weight over this past year. Everybody's been in their house. The gyms were closed for a while, the rec centers. People have gained weight, stress eating maybe. Their mental health is not good. We've been starting, a lot more antidepressants, a lot more anxiety medication than I had in all my other years of practicing. So, we need to continue to think of mental health, but just common sense things. Because when people gain weight, their blood pressure goes up, their blood cholesterol, the cholesterol goes up, their blood sugars go up. So just not overlooking, not neglecting those kind of basic components of health. But another thing we did, just talking about healthcare, was to have legislation this past session that lifted a lot of barriers to vaccine administration. That was a big issue that I think we didn't do a good job at. I think we could all admit that Virginia was, especially in the beginning, not doing well at all. We were, depending on which list you looked at, we were 49. I think one day we were 50, and the vaccine rollout, we were doing that bad of a job of getting vaccines and of getting that vaccines in people's arms. So we, together again with my healthcare team, with the one doctor, we've got a dentist, we even did get some bipartisan support, but came up with a great bill that lifted a lot of the training, we called them barriers, but a lot of the training for people to sign up for Medical Reserve Corps. I signed up for it, and I had to go to an in-person orientation, do about 7 online training components. I had to re-up my CPR qual. I had to go in take a picture, do all these things. And going back to school. Right. And I didn't have time to do that. Yeah. Either does any other healthcare provider. So we wanted to include medical students, nursing students, other allied health professions, dentists, therapists, people who can give shots. So pharmacists. So our bill did that, and it was wonderful. We did a big press conference in Richmond. The House reacted quickly and came up with their own version of this lifting these barriers to administration. That did have an emergency clause on it. It passed overwhelmingly in the House and the Senate, and so it's good, because that's half the battle. Half the battle is getting the number of vaccines we need, but the other half is actually getting the healthcare providers and administrators to put them in arms. I've been a part of a couple of mass vaccination clinics at the convention center. We have definitely grown and improved. And the health department has been working. They've been working hard. They're taking a lot of heat, but it's just, they're not equipped for this. They do a little bit of public health, vaccines here and there, STD, they're not equipped to vaccinate the entire population of Virginia. So with what we asked of them, it's a work in progress. We've never been through this type of pandemic before in our lifetime. So they've gotten better. I think it's going better in many places. I read an article yesterday that we were up to number 12 out of 50 states in the country. So I think we're doing the right steps. Now, we can put some blame on the administration, because I don't think they should totally get off the hook, because the governor is a physician. So we should have, and I'm going to blame him, but maybe all of us should have had some foresight and said, what can we do legislatively during special session? Even we should have done this to get that vaccination ball rolling. I don't know if we didn't know when it would be here. We didn't know how many we would have, but if we would have thought a little sooner into the actual implementation of giving the vaccines, this whole thing, could have been prevented. But it is what it is. We're here. We're doing a little better every day. We just got 79,000 Johnson & Johnson vaccines this week. Those are one-shot vaccines, which makes it a little easier, because I will say that the Pfizer and the Moderna brand, they're two-shot series. So one's 3 weeks and one's 4 weeks, and you got to keep track. So the whole tracking system has been challenging. So I think with those 3 vaccines available to Virginians, we're doing a good job. I got my 2 Pfizer vaccines. I encourage everyone else out there to get all my patients. I mean, there are a few that are still kind of hemming and hawing, but nobody's lost their hair or grown a third arm or anything. A lot of stories out there, and I think conspiracy theories about the vaccine. But if you're willing and able, get it. I don't think it should be mandatory in any way, shape, or form. But if you're willing and able, then please do your part.
Well, Jen, that's incredible. I had a conversation with Dr. Lindsay yesterday, the health director.
Yeah.
And a lot of folks don't realize the logistics, this whole vaccination event, right?
Right.
And your bill, certainly opened up opportunities, because there's a lot of volunteers that are on the bench going, hey, put me in the game, coach.
Right.
I don't have to go through all this, licensure and, tutorials and all that. But your bill has helped tremendously. And, only 2 years in, man, you accomplished incredibly a lot, and we're so proud of you and what you're doing. I know you're a former veteran. I'm a former veteran. Thank you for your service.
Thank you.
We see that, some of the bills that you carried and that are near and dear to your heart. How are the veterans issues up there in the General Assembly?
Yeah, very important to me. I mean, I was a helicopter pilot in the Navy for 10 years and missed that job a lot. It was a great job. I'm sure you miss your time in the service too. We all learn a lot. My husband was a F-18 pilot and did 20 years. We've got a son at the Naval Academy. So, we big Navy family, a lot of our friends. So military families are important to me. I was a Navy, not only a naval aviator, but also a Navy spouse for 20 years. So I got to see both sides of the fence. And one thing that I did this past session was to advocate for those people, for the military spouses out there. My military spouse liaison bill passed both the House and Senate, and was given funding, which is a half a battle. But it's a bill that allows for a new position in the Department of Veterans Services up in Richmond to be solely devoted to helping and advocating and supporting our military spouses out there. There are so many throughout Virginia, not just Navy, but our Army and Air Force, so much military here, that having a person who can help with finding, schools and employment, certifications, dealing with local laws, now dealing with new COVID restrictions, whatever questions and support military spouses need. We're in and out of Virginia, in and out of different states. So it would be so nice to have just a person who's solely dedicated to them. We worked with the Navy League. They were, it was actually their idea. They had requested that we have a person in place that just dedicated solely to spouses. So I'm really excited about that bill. I think we're an under advocated for group. And I hope that goes a long way to helping our spouses and translating into keeping our military families here in Virginia, even after retirement. I think that should be a goal that we look at. Along those lines, I had another bill that not a new idea, but there's been a variety of bills from not taxing our military retirement income. I know this is a hard budget year to ask for a lot. So my bill was simply a tax break for some of the state taxes for our military retirement pay. It was based off of your income. So people that were made less than $82,000 a year were eligible. And then depending on your age, if you were less than 65, it was a $2,500 tax break. Older than 65 was a $5,000 tax break. It was it was a small ask, but it was a place to start at least. And so all of the bills that were of that nature, that were tax breaks or tax cuts, went to a special tax subcommittee, I guess you could call it, and it's sitting there right now. They didn't take any action on those bills. They're, again, just a lot of administrative priorities that were that needed funding first. So I was told we will look at them in the interim, but the bill sits. So we'll keep reminding them that it's there, because I do think that's just another incentive to keeping our retired military, here in Virginia.
Jen, in looking at some of the bills, there's one bill that I know when I served in the General Assembly was always on the docket. Never got enough proper attention, but never really had a true champion. Your balloon release bill, you actually got that through, and a lot of folks don't realize how important that is. Could you talk a little bit about that?
Yeah, I will. It's a bit of a controversial bill, actually, and I did carry it last year, so I think that's pretty well known. And I voted for it this year, and there was a couple of Republicans that voted for it. I'm not a fan of big government. It's a bit of an overreach, but for our area with the Chesapeake Bay, and we've communicated a lot with those guys, Lynnhaven River now, the aquarium, it's a form of littering. So I just look at it purely from that, littering's illegal. We actually increased the fine for littering this year. So I think we talk about mass littering now. Littering's an issue, right? If that's something that we see, and littering's illegal. This is just another form of littering for me. There was a lot of statistics and stories about its effect on sea life and sea animals. Gosh, around Virginia Beach, you could talk about our aviation community. Ask my husband about balloons and jet intakes, not a good thing, so there's a lot of other reasons too. But my bill allowed people to release one balloon into, I don't love the no balloons ever, but you get a yes or no vote. So I did vote for that bill. I rarely vote for big government overreach bills, but I knew this one was important to my district, important to a lot of my constituents, actually. So happy to vote for that.
We appreciate all your efforts, Jen. Jen, going back to the veterans issues, when I was there, Delegate Stahl and I, we championed the Veterans Care Center. What is there any updates on what's transpiring here in Virginia Beach?
No, I don't have an answer for that. I have not heard. I need to look into that myself, because I know that when Delegate Stahl wasn't successful in November, we actually moved into his office space, and he had a lot of. Yeah, that's where I am right now. So, but we'd love to have him back actually at some point. But yeah, there was a lot of just posters around about the design and whatnot for that center. It has not been talked about lately. So now that we're done with being so busy in Richmond, I'm gonna look into that, and we can get back to you.
Yeah. So Jen, I drove by there the other day. It looks like they're clearing trees, and
oh, good.
There's some foundation work going on, but just you haven't heard anything about it.
I haven't lately, but we do need that. Gosh, we need that. I worked at the VA for a little bit in Hampton, and I know, we've got the one center over on Witch Duck Road, but we need more just accessible, available care for our veterans. So I hope that's expedited, but I'll get a timeline for you.
Jen, in this segment, I'm going to ask you a couple of topics, just quickly answer how you feel about them, and you could extrapolate all you want on them. Cannabis is legal, or what we call marijuana is legal in Virginia now. How do you feel about that?
Yeah. So that would Bill. I was on the marijuana subcommittee, meaning my first week of session, I sat through 10 hours of debate about this bill in 1 week. Didn't talk about kids in school, vaccines, but sat through 10 hours of legalizing recreational marijuana. It's a very controversial issue here for us. It was a 400+ page bill, thousands of lines. It was an immense, huge bill that, in my opinion, we didn't need to push like we pushed. We needed to slow the roll on that. This bill legalizes, home cultivation, the recreational marijuana, the retail. It's got a lot of criminal justice issues in it. So much information, and pushing that through in one session is not the right idea, in my opinion. I was supportive of the pharmaceutical industry and the medical marijuana piece. I've toured. Columbia Care is one of the 5 facilities in Virginia that is very regulated. We spent a long time in sessions before I got there just of coming up with medicinal marijuana, how we were going to handle that. I mean, I have patients that do benefit from it, who have seizures, epilepsy, end-stage cancer. I mean, I think there are some evidence-based research diagnoses that, and just diagnoses that support the use of that. I'm worried about that industry because opening the floodgates, which is what this legislation does, that we've passed, and a very close vote, 20-19. We had a Democrat vote with us, and we're one short because we had a senator, pass away, Ben Chafin. So it was a 20-19 vote on pushing through this immense bill. But I'm worried about the medical marijuana industry because I feel like they're going to be hurt by this, and they've worked really hard to do things the right way. It's like I said, very regulated, a lot of security measures in place. I mean, I was overall impressed with the facility I visited. I want to see them succeed because I think it benefits some of my patients. And I'm worried that it's not going to be able to succeed in the environment that we're creating now with this legislation. So we'll see where it goes. It's on the governor's desk. I'm sure that he will at the last stages of voting for that bill. There was a lot of questions about just the criminal justice pieces and if it was too strict, not strict enough, the expungement pieces. So very complicated issue. So we'll see where it goes from Governor Northam's desk.
Jen, right to work, Virginia is like number one, the top business states to do business with. And it's because of our right to work laws partially, but we've seen an assault on that. What happened this past General Assembly on the right to work?
Yeah, thankfully that bill didn't get out of committee, so there was no passage of any. There was discussion of that, and I know that was one of their priorities and on their agenda, but nothing has changed. So this is good. This is a small victory for our business community, but like all of their priorities, generally they'll be back. So we'll continue to watch for that.
If folks want to get in touch with you and have an issue or concern, how do they get in touch with you, Jen?
Yeah, so we've got an office in Haygood. It's again where Delegate Stolley's office used to be, right off Haygood.
Senator Kiggans' office, yeah.
It is. We changed the sign, but so we have office phone number. It's 757-990-3080. Mm-hmm. You can just Google my name if you want, and our website comes up that has our not only our phone number on there, but also our email, district07@senate.virginia.gov. Social media. I love my social media. So Facebook, Instagram, Twitter on a rare occasion, but we try to stay away from that. But social media is a good platform to reach me as well. We're back in district, so that's nice. I have two wonderful staff that work very hard every day that are here. We help with a lot of DMV appointments. That seems to be a very popular item we do because it's hard to get an appointment these days. So please call if you need help with that. A lot of unemployment assistance. We have some great contacts with the VEC that we're working closely. So let us know if we can help with those things, and just letting us know your opinion on issues. They give me numbers and reports, and I read through my emails a lot. I have some help responding to the hundreds of emails we get, but I do take a look at that inbox and just to get a flavor of, are people supportive of this, not supportive of this. So let us know, how you feel, and if you have an opinion on legislation that we've passed or that was pending, or just ideas for the future. Would love to hear from people.
Senator, I know the 7th District's blessed to have you as their senator. And I noticed your website is Jen for VA. So in the future, do we see you running for governor or Congress lady or something like that?
Well, you'll have to stay tuned. We'll see. We never say never, right?
Well, I mean, you've got a tremendous background and you've accomplished a lot. On behalf of the Coastal Virginia Chamber of Commerce, thanks so much for giving us a General Assembly update. And we invite you anytime you have an update or an issue you want to help get out to the public and to the membership. We appreciate you very much.
Thank you. Well, thanks for having me. It was good to spend time with you.